Hello, and welcome to Unit 2 of the module on diversity, inclusion, and cultural humility. I am Dr. Nnamdi Moiteke with the Department of Community and Public Health at Idaho State University. In this unit, we'll define different types of bias, discuss internalized oppression, and explore socialization. We'll also explore how biases are formed and consider the application of bias to the places and spaces we live and work. First, let's start by level setting with some terms. For the purposes of this discussion, bias is defined as an unfair preference for or dislike of something. These biases are considered unfair because they are unexamined. There are two different types of biases. First, we have explicit biases, which are clear and obvious. These are the ones that you know. You likely have a favorite color, a favorite food, or may have a favorite kind of music. It's clear and obvious, and your actions reflect these preferences and the choices you make. Implicit biases, however, are implied. They are not stated, and most of us are not consciously aware that they exist. They are not as clear and obvious, yet they are indicated by what is expressed or acted upon rather than what is stated. Explicit bias is conscious. We know that we are acting upon our preferences. It's deliberate. We make definite choices based upon our preferences for or dislike of things. For example, you could like chocolate over vanilla ice cream. You have a favorite cousin. It's conspicuous and it's identifiable. However, implicit biases are unconscious. They are often denied by those who discover that they have these biases because they are hidden, and their effects are not as easily recognizable in our day-to-day lives. That said, implicit bias is also insidious in that it kind of festers beneath the surface, and if left unchecked, can have a huge impact on the way that we interact with people, the way people perceive us, and even on policies, programs, and practices in our workplaces and organizations. Now let's consider when biases begin and why biases are so harmful. Research has discovered that racial biases, for example, begin as early as 6 months as babies notice visible race-based differences. By ages 2 to 4, children can internalize racial bias and act upon it. By age 12, many have already become set in their beliefs. Because of the environments they may grow in, such as parents and caregivers, they notice social category labels, social status, and bias-influenced behavior exhibited by family members. Biases and the stereotypes that go along with them can unconsciously affect opportunity access for minoritized groups that historically have less societal privilege. This is particularly the case within the systems that these biases are present. Before we dig into the types of biases, let's understand how biases are informed by our brain. All of us have 3 primary parts of the brain that work in any given combination to influence each other and also may influence our biases. The first part of the brain that you will notice towards the back of your head is the reptilian brain. This fundamental, compulsive, and most primitive part of the brain instantly classifies your subjects as a danger or not. It governs some of the most basic emotions, such as fear, sex, shelter, food, and whether someone is a friend or enemy. The limbic brain, also known as the mammalian brain, is the part of the brain that governs feelings and emotions, and it also connects memories. It associates past experiences and unconsciously influences our behaviors and motivations. This may be the part of the brain that, say, for example, makes the smell of homemade apple pie or fresh baked cookies think of your childhood. Conversely, if there's a similar smell or person or place or thing that reminds you of something negative, that's also going to invoke negative feelings and emotions. It's your limbic brain that's connecting those feelings and emotions. The most developed part of the brain is the neocortex brain or the human brain. The human brain controls language, ideas, concepts, and artistic visions. It's the learning part of the brain that really engages with abstract thoughts, imagination, reasoning, and planning. This is the part of the brain that can be influenced by learning and development opportunities like the one you are in now. That gets you to think more consciously about your perspectives and interactions. So if you bring these three parts of the brain together, the reptilian brain, governing instinct, dominance, and survival, the mammalian brain, or limbic brain that governs feelings and emotions, and the neocortex or human brain that's evolved and engaged in language, ideas, concepts, and artistic visions. These three together at a computing speed of 38,000 trillion operations per second, followed by our gut instinct, leads to reaching our snap judgment points, the primary means through which biases are expressed. Before we get into the different types of biases, let us consider some sobering statistics about the effects of bias on opportunity and access. Let's look at some impacts of the resulting bias, particularly as it relates to different identities. There are several identities with accompanying types of bias: gender bias, age bias, beauty bias, height and weight bias, name bias, and so on. So for each of these types of bias, there are some quite compelling statistics that show us the real impact of biases in our society. First, we have statistics on racial bias. 48% of African American women and 47% of Latino women report being mistaken for administrative or custodial staff. Similarly, resumes with African American, Asian, and Hispanic sounding names are less likely to get callbacks or interviews. Those who attend historically Black colleges and universities may also receive the same bias. Here's one about height and weight. Less than 15% of US men are over 6 feet tall, yet 60% of corporate CEOs are at least this height. And a taller man is more likely to earn more than a shorter man. This demonstrates that height bias definitely exists, along with accompanying vertical privilege. That vertical privilege is often associated with leadership, though only 15% of the population meets that criteria. It goes to show you how biases and stereotypes can unconsciously affect opportunity access for the minoritized groups within the systems they are present. And for the sake of clarification, minoritized here refers to a group that is subordinate in status to a more dominant group or its members. Minoritized doesn't mean that there are fewer of those group members, just that members of that group have less relative social privilege. For example, though women are not a numerical minority, they are still minoritized in the workplace. That said, what's the impact of this kind of bias against typically minoritized groups? Well, it's not good. Alienation and disengagement are the first set of the negative effects. When bias-based behavior is experienced, people can often feel it. They may have a lower sense of belonging and psychological safety, and as a result, disengage from their roles. If employees don't feel valued because of bias, they can decide to keep their great ideas to themselves. This means that we are not experiencing the innovative benefits of multiple perspectives that a diverse environment brings. The impact of bias can ultimately lead not only to increased accidents and absenteeism, but ultimately increased turnover with departure of employees from the organization. This has a twofold effect: the loss of great talents who could assist with the advancement of the mission of the organization, and the expensive cost of replacing employees. Turnover is also a drag on morale, which is likely low for those who may be on the receiving end of bias. For people of color, racial bias can also lead to racial battle fatigue. Racial battle fatigue is the result of the negative, racially charged experiences of people of color in the United States. Now let's talk about the cycle of bias and its different types. The first type of bias, and the one that we will focus on, is individual bias. This type of bias affects experiences and perspectives and how we interact interpersonally. Organizational bias can affect policies, programs, practices, and people within the organization it is present. Structural bias refers to the inherent bias in systems and institutions, such as education, criminal justice, health, and the media. And finally, social bias refers to the societal and cultural norms that determine the haves and the have-nots in our culture. As we mentioned earlier, we'll focus on individual bias for the purposes of this discussion and how it affects our interactions. While there are many more types of bias than we'll explore, I would like to make you aware of 4 that can have a particular impact on one critical element of organizational operations directly associated with opportunity, access, and expansion. The first type of bias we'll explore is affinity bias. It's just what you think. And similarity bias, or the tendency people have to connect with others who share similar interests, experiences, and backgrounds. So in a healthcare seeking setting, this may yield an affinity for those who are more like you. Confirmation bias is the inclination to draw conclusions about a situation or person based on your personal desires, beliefs, and prejudices rather than on unbiased merits. Attribution bias has to do with past interactions. And this is judging a person's behavior on prior observations and interactions you've had with them, which influences your perception of them. Conformity bias is a lot like groupthink or peer pressure. It's a tendency to act similarly to the people around you, regardless of your own personal beliefs. So what do you think? And can you think of an example of this happening? Have you been on the receiving end of one or more of these types of biases? And what was the impact? Perhaps upon reflection, you may realize bias has crept into some of your interactions. Probably not. Perhaps you think you are immune to biases and all that information about snap judgments in the brain doesn't apply to you. But if we take a peek into our minds, we could be surprised. And there's definitely a need for constant reflection and rectification. Thank you, and see you in Unit 3.